Hi, I'm Dr. Wright. I want to show the physical signs of lipedema. Lipedema is poorly recognized, but if you can pay attention to these physical signs, people will recognize it much more easily. So the first sign that is very apparent is called a cuff sign, and this is where you can see that her wrist goes has a lot of subcutaneous tissue and then thins down as though she had a shirt cuff on. And the best way to appreciate a cuff is actually to hold the hand out and look at it, and you can see here that the cuff comes in at this. It's difficult to appreciate with the hands out at the side, but you can. Then as you go up, you can feel a nodularity to the lipedema tissue. It's the tissue is soft, and you can feel these nodules in it. And you can see here she has this disproportionate fat accumulation, is more in her extremities and less on her trunk. She's thin and yet has out of proportion fat in her arms. And then if you look on her legs, you can see again, and you can see here there's a cuff at her ankles, and she has disproportionate fat on her at her ankle, on her calves, thighs, and then as you go up here, you can see that she's actually normal weight, and even though so she is so here you again, the cuff is appreciated best looking at it straight. It actually is easier to appreciate it from behind. And so you can see as she turns around, you can really see in this medial and lateral malleolar sulcus that there's increased adiposity in there. And again, this tissue is smooth on the skin, looks smooth, but you can feel the nodularity in it. But there is some dimpling. So she would meet, because she does have some dimpling here in the thighs here, she would be a stage 2, and then because it's from the ankles to the hips, it's type 3, and then in her arms she would be again just barely stage 2, and this in the arms is called type 4 lipedema. So she has classic signs of lipedema in her arms and legs: the disproportionate, the nodularity, the cuffs. And then if you come in here closer, and I'm going to show you that this is called the Gotrins, or some people still call this the Kaposi stemmer, but it is actually, in the hands, it's called the Gotrins sign. And then if you can have her, then you have the patient sit, and you can see here that this is the skin on the top of her foot pinches or tense easily, and that is a negative stemmer sign. So those signs that I've just demonstrated here in this relatively early stage lady with lipedema are classic, and if you can pay attention to them, you can easily recognize it. So thank you. I hope this was helpful for you.